ในช่วงนี้เรามาพบกับผู้บรรยายท่านต่อไปเลยค่ะ Professor เป่ยชันหยางนะคะท่านเป็นรองศาสตราจารย์ของภาควิชาสังคมสงเคราะห์ศาสตร์มหาวิทยาลัยแห่งชาติไต้หวันนอกจากนี้ท่านยังเป็นผู้อำนวยการศูนย์วิจัยด้านนโยบายสังคมและเป็นที่ปรึกษาด้านกิจการผู้สูงอายุของกรมกิจการสังคมกระทรวงมหาดไทยของไต้หวันดร.หยางสำเร็จการศึกษาด้านสังคมสงเคราะห์โดยได้รับปริญญาโทและปริญญาเอกจากมหาวิทยาลัยโคลัมเบียท่านมีความเชี่ยวชาญด้านผู้สูงอายุและบริการสังคมสำหรับผู้สูงอายุค่ะในช่วงนี้อาจารย์เพรสจะแนะนำวิทยากรท่านที่2เป็นภาษาอังกฤษค่ะเรียนเชิญค่ะ
So I would now like to ask our second keynote speaker, Professor Pei-Shan Yang, to give her presentation. Professor Pei-Shan Yang is an associate professor at the Department of Social Work of National Taiwan University. Professor Yang has been appointed as the director of the Social Policy Research Center since January 2011. She's also a member of the Elderly Welfare Advisory Committee at the Department of Social Affairs of the Ministry of Interior in Taiwan. And Professor Yang received her PhD and MSW from Columbia University School of Social Work. Her research interests focus on gerontology and social services in aging people. Professor Pei-Shan Yang, thank you very much, and you may start your presentation.
Sawadika, happy anniversary for the 67th anniversary to all of you at TaiwanUniversity. My topic today is to share with you challenges posed to social work and social welfare policy by the COVID-19 pandemic in Taiwan. First of all, we all know that COVID-19 coronavirus pandemic continues to evolve and change. There are many changes in the virus right now, and we have continued to see worldwide confirmed cases increasing every day. And also we have a lot of deaths around the world. However, there is also a positive side. We have also a lot of recovered cases. Recently, there are new cases in Taiwan, which has posed very serious challenges to our COVID fight. As I have heard from the news, there are similar situations in Thailand as well. So today, when we share such important topics at the seminar, I think it's very meaningful that we can learn from each other and fight this coronavirus together. Since last year, we have already seen unbearable losses of lives around the world, including those who care for us at the medical settings of doctors, nurses, and other medical professionals. This pandemic has caused huge impact on our societies globally. Most of all is health, and our health system is facing serious challenges. Other than health, national and international economy and global national relationships have also faced serious challenges. Personal employment and income has been seriously affected. Just now, Dr. Antonius Rompakis has also shared science data from the UK study. We also have seen increased poverty and inequality. Family dynamics has been changed, and as social workers, we have had an increase of family violence cases education system has been shut down in many countries. Luckily, the schools remain open in Taiwan. Traveling and tourism are still shut down in most regions. And we have seen the patterns of production, consumption, and services have been shifting and changing. In COVID-19 situations, we have observed a hit most seriously to the least developed nations. Nearly half of jobs were wiped out in Africa. United Nations Development Program Administrator Achim Steiner said, "We risk a massive reversal of gains made over the last 2 decades and an entire generation lost." So, as nations doing relatively fine and standing strong during COVID-19, we in Taiwan have global responsibilities. And of course, we shall not forget the impact on human rights in this pandemic. For example, in the US and the European countries, there are borders closed. And also we mentioned about traveling bans, etc. Another major issue is food and water insecurity. The number of adults who are food insecure in Britain is estimated to have quadrupled under the COVID-19 lockdown. Not all households were equally affected. Studies showed adults with disabilities and adults with children were particularly vulnerable. Groups at risk of poverty are at risk of food insecurity at this time. This is in Britain. Situations are far worse in less developed regions and countries. In the midst of COVID-19, countries face other serious challenges in life. Challenges in other fields and other areas of problems do not stop because of COVID-19. For example, in Taiwan, we are facing a social dispute posed by the US imported pork containing ractopamine. In the legislative yuan and online, we have seen a lot of disputes challenging the government's policy related to this issue. Also, we have experienced in the current season the worst drought in the past 68 years. And reports and studies repeatedly remind us that this worst situation of drought has not only caused by climate change, but also by social and economic changes. In that, right now in societies, the country has decided to support water to the computer industry in certain areas, which made the farmers in those areas have to stop growing their crops. Talking about challenges in Taiwan posed by COVID-19, I will make the following points. Number one, though COVID-19 has made relatively small changes in the way we live in Taiwan, however, serious challenges exist. First of all, we are still excluded from WHO, even with many global allies supporting us at WHO meetings. And the second one is we still have no vaccines yet. Last week, I have shared some exchanges with TaiwanUniversity faculty, and I understand that you have already started the vaccines. But right now in Taiwan, nobody, from the president to the common people, nobody has received vaccines yet. I think this will be the biggest challenge facing us in Taiwan from now on. And the third one is border control and travel ban versus economic development and the trades. In January, there was a New York Times report which doubted Taiwan's current strategies. A professor in infectious disease at the National University of Singapore, Del Fisher, was quoted in the report. He said, "How well would Taiwan's people bear being sealed off from the wider world for another year or another 5 years?" And we have no answer for his question. In terms of the society, we also have faced serious challenges in Taiwan. In one topic phrase, I would title it as bigger divide. There are 4 subdivisions I would mention here. The first one is the digital divide. How people in Taiwan altogether will live in a virtual world after COVID-19. And the second one is the rich versus the poor. Similar as the presentation by the UK professor Antonios, we have also seen the gap increasing between the rich and the poor in Taiwan. And the third divide is between the urban and the rural areas. For example, the huge number of population in urban areas have posed serious challenges how to prevent the spread of COVID-19. In current upsurge of new cases at Taoyuan City in Taiwan. Taoyuan City is the closest city near the international airport. And now they have experienced a semi-spread in communities, which has a lot of alarming messages coming out. So we are kind of not very nervous right now in Taiwan. And the fourth divide is the young versus the old, because they have different routes of getting information, different way of lives. So their challenges post COVID-19 are very different. In our government, there are 3 keystone policy approaches taken by our government in Taiwan for COVID-19, which is fight, relieve, and boost. In terms of fighting COVID-19, we put health policies first. And number 1 strategy is protecting our national health insurance system and all the hospitals and medical system. The national health insurance system in Taiwan was enacted in 1995. And by now, it has over 20 years of experiences and has won high consensus in the Taiwanese societies. And the central government, while controlling the COVID-19 fight strategies, they allow local government to take their own initiatives, so to make the system and fight more flexible. And also, they try to enhance community health by close monitoring of individual health. And right now, we are applied technical aids from a system called Skynet, which is the digital surveillance system to track all the infected cases' footsteps. And also, the government is doing their best to support NGO efforts in helping individuals, families, and vulnerable groups in home, community-based, and institutional settings. The second strategy, keynote strategy, is to relieve, and the third one is to boost. With that, the government tries to support major industries first, and then they have given out loans for small business, and they have given out about 460 million US dollars worth of stimulus coupons and vouchers for citizens last year. So by the end of last year, 2020, most people have already used up their stimulus coupons and vouchers and have created a good effect on the economy. So totally, we had a GDP growth of 2020 by 2%, which ranked pretty high in the world. With this picture, I think the WHO integrated care models published in 2016 have explained our strategies fairly well. Even though we are not in WHO, try to follow WHO suggestions and policies diligently. In that, we can see we try to use resources and policies to support our community and healthcare system. And the strategies we use are self-management, delivery system design, decision support, clinical information systems. And also we try to support the productive interactions between the patient system and the practice team system in order to have improved outcome of integrated care and health. I think one very good thing that the government has been doing since the outbreak of COVID-19 is that they try to maintain a high level of public transparency. They have done a lot of different measures to combat mis or false information. And our government, the central disease control, has issued press conference every single day. When we have any alarming information, then the Minister of Health will host the CDC conference daily. So he's been working nonstop since last year. Okay, that's why our whole society and the people have supported our Minister Chen Shizhong very much. And also on the civil society level, there is an NPO called Taiwan Fact Check Center, and people can go online, report or check any information that they have received online or in person to see whether it's true or false. In that, so far we have been able to maintain very high level of social trust, not only to the government, but to each other. And we try our best to encourage mutual help and altruistic behaviors in society. Even before the COVID-19 outbreak, there have been major social welfare policies ongoing, which has not stopped after the COVID-19. Today, I will share with you two major social welfare policies. The first one is called Plan to Strengthen the Social Safety Net. which has been happening since 2018. There are 4 strategies in this plan. Number 1, to increase the number of district social welfare centers. So to increase the availability and accessibility of social welfare services to common people, especially those in need. Strategy number 2, to integrate protective services and high-risk family services. So to catch the high-risk like abusive situations in advance. Strategy number 3, to integrate social services and the mental health services. Strategy number 4, to integrate service networks of welfare, education, employment, violence and crime prevention, and health. So to make a more integrated social welfare system in large. The second social welfare policy area will include the 2 major acts and the plan. The first one is Long-Term Care Service Act, which was passed in 2015 and put in practice in 2017. With that act, we are trying to administer a plan called Long-Term Care Plan 2.0 since 2017. The Long-Term Care Act Plan 1.0 was started in 2007. 10 years later, now we have Long-Term Care Plan 2.0. 4 major areas of this plan include to enlarge the care services system, including home care, community-based care, and institutions. And we try to improve our transportation services. In that case, many citizens have donated transportation vehicles to improve our transportation services to non-for-profit organizations in communities. And we also try to use our technological power and the capacities to improve the system for assistive devices and the barrier-free environment. The government has put a lot of money in this area. And also, because we understand family caregivers are the main caregivers for long-term care recipients, therefore, in Taiwan, we do our utmost best to support our family caregivers. And in Long-Term Care Plan 2.0, we have increased respite services for family caregivers. In our fight for COVID-19, what may universities help? I believe that we need to upgrade our research and the innovation and the speed of it to link knowledge and action and to open our universities even more to the society at this crisis time. And we try to integrate what we are doing in terms of research and innovation, aiming at the United Nations Sustainable Development Goals through our university social responsibility programs. And NTU, for example, has issued our first USR report last year in June 23rd. And my own personal research has also indicated partial success for prevention of COVID-19 in Taiwan. Some reasons I have analyzed for the success include, number 1, we have a social culture of diligent infection control because we had terrible SARS experiences. We still try to learn from what happened in SARS and use those meaningful and successful strategies while we are fighting COVID-19 now. And number two, we have acted very rapidly through organizational network from central to local governments to various health institutions in the communities. And number three, we put patients first of all healthcare professionals. Okay. Yet, there were hidden costs in our strategies, making health professionals putting their patients first. The health and the well-being of healthcare professionals is my main research concern right now, because they have also impacted by the strict payment system control of our national health insurance. Due to some cuts as well to the payment, our health professionals have experienced difficult physical, mental, emotional, social, and spiritual challenges. For example, fatigue, stressful work environment, and they are facing possible infections right now. Mentally, they are under high pressure and anxiety. And some professionals have experienced and shared their grief during this time. And their social, family, relationships, and functioning also have been impacted by this COVID. And we have to ask and be considerate of their consideration of meaning of life and the death. And in terms of challenges posed to social work, both the young and the old are vulnerable to such a pandemic globally. So our biggest challenge, I perceive, is how to reconstruct a healthy life for all. Our new focus should be health for all. That is to say, we all need to live with illnesses and symptoms, and we all need an integrated health. Well-being, security, equality are major focuses in our profession. At this time, I'd like to focus social work ethics once again. We need to be responsible for our own health, that is self-help, and we need to be responsible for others' health, that's mutual health, and we need to reconstruct a healthy ecosystem, that's global health. We need to have a prospect of a global culture of healthy life and solidarity. I hope every one of us will engage ourselves in contributing to a caring world for all. Social workers need to plan and practice a holistic life, integrated body, mind, spirit, health. And we need to design eco-friendly mechanisms and operation. We need to engage in social participation. We need to invest in health institutions. At this time, we like to put public institutions first. So all social resources will put public institutions first. And that means we may have to sacrifice a little bit of our personal lives. And we need to research in science and the social science, especially social sciences also need to be part of the major investment. Major strategies at this COVID time, pandemic time, we need cross-national collaborations. And I wish Taiwan can join WHO fast. And we need all the support internationally as we can. And at this seminar, I would ask for your help to help our future efforts in joining WHO and all the nations in our global fight against COVID-19. And we also have interdisciplinary team building, civil education and practice, online and offline. And we need to use the utmost and the most innovative information system and platform that we can think of to fight this pandemic. And the government, no matter central government, local governments, or global nations, we need to innovate our health policy and programs and our systems. And we need to share of our research findings and experiences as fast as possible with the right information with the public. That's all my presentation for today. I believe that we shall overcome this pandemic with our joint efforts. Thank you very much.